Welcome to CES 2021. Thanks for joining us today. I'm Randy Kellogg, President and CEO of Omron Healthcare. As those who follow Omron Healthcare can tell you, our team has invested in innovation for new tools to measure and manage blood pressure. In the last 3 years, we've introduced the first wearable blood pressure monitor and the first blood pressure monitor with EKG in a single device for use at home. More importantly, we've delivered on what we've promised. The technology we've shown here arrived in the market as FDA-reviewed medical devices, meeting the highest standards for performance and accuracy. And we've seen our technology have measurable, meaningful impact on consumers who rely on us to manage their hypertension and to gain important insights to form a complete picture of their heart health. As we've looked around CES last year and this year, we can see that Omron has transformed the global heart health marketplace. There are more wearables, there are higher standards of accuracy, and there are more health devices that take lifestyle into consideration. That's a good thing. That means more lives can be saved. This year at CES, we have an important announcement to make about what we are doing to serve and save those who are near the high risk levels of hypertension. Before we share those with you, I want to emphasize our why. Why we are here, why we are making these announcements, why we work so diligently to deliver on what we promise. Our mission is going for zero. Zero heart attacks and zero strokes. Going for zero is at the heart of everything we do. Going for zero is a big, bold mission, and it has to be because the challenge is enormous. 1 billion adults globally are hypertensive. That includes 116 million adults in the United States. Of the 116 million American adults who are in the hypertensive range, more than 37 million of them have uncontrolled stage 2 hypertension, leading to greater risk of heart attack and stroke. Hypertension comes with higher risk for heart attack and stroke, and it's also a leading underlying health condition for greater risk of complications from COVID-19. For those at the higher end of the hypertension scale, the risk now is even greater than before the pandemic. In fact, recent reports have shown that heart attack death rates have more than doubled during the COVID-19 pandemic, with fewer patients going to the hospital when they're experiencing symptoms. This is alarming. It means that many of these patients are not visiting their doctor during the pandemic and managing their hypertension. It means that the heart attack and stroke fatality rate, which is already at a crisis level, is even higher now. If you've heard me speak before, you know that I've talked about 80% of heart attacks and strokes being preventable, and that requires active management of one's condition. So this year at CES, we're introducing our first remote patient monitoring service for Omron, VitalSight. It's designed specifically for hypertension management. Omron created VitalSight for more active condition management and more patient-to-physician dialogue. If you're one of those patients, we created VitalSight to help you live a longer, healthier life. We created it to save your life. I'm joined today by Jeff Ray, Omron's Executive Director of Business and Technology, who will tell you more about VitalSight.
Thank you, Randy. Our team has spent several years working with physicians and listening to their needs to make a remote patient monitoring service that is easy for clinicians to use and easy for patients to build into their daily routine. As Randy mentioned, VitalSight is designed for hypertension management and developed to foster greater patient-to-physician communications and data sharing, ultimately leading to improved treatment engagement and health outcomes. We knew that physicians and patients were looking for easy-to-use, accurate services, so we made VitalSight easy and simple. Physicians can use their electronic medical records to enroll patients who are at risk of high levels of hypertension. Patients then receive a kit delivered to their home that includes an Omron-connected blood pressure monitor, a weight scale if their doctor orders it for them, and a connected cellular hub that transmits the data to their patient's physician and care team. The kit is plug and play and ready to use right out of the box without any need for Wi-Fi or a separate cellular connection. So let's take a look at the VitalSight video to see how this all works together.
VitalSight by Omron puts the power of home blood pressure monitoring into the patient's hands. Eligible patients can be easily enrolled in minutes via the electronic medical record system at zero cost to the patient or doctor, and it's reimbursed by Medicare. Patients receive a kit at home that may include a digital blood pressure monitor with cuff, weight scale, digital medication tracker, and data hub. The plug-and-play system arrives with all components ready to use and linked to the physician's EMR system. Patients measure their weight, then their blood pressure, and take their medication as ordered. Data is sent to the doctor's EMR in real time. If all's well, it's stored for reference. If there's a health concern, the physician's office is alerted. VitalSight is securely encrypted, meets HIPAA standards, and is compatible with Epic and other leading systems. Omron provides complete patient technical support, and we even help the clinic manage billing, from submission to reimbursement. Physicians get simplified patient management while staying connected to the patient at home. Patients get peace of mind and personalized care, ultimately helping to improve health outcomes. Make VitalSight part of the patient's ongoing care and join us in going for zero. For more information, visit omronhealthcare.com/VitalSight.
And VitalSight can be integrated directly with the clinician's electronic medical record system or through the Omron Doctor dashboard. VitalSight sends automatic notifications through the EMR that signal when a patient has readings that indicate if action needs to be taken. VitalSight fosters stronger patient-to-physician communication and helps to focus the care team on urgent patient health data so they know when action is necessary. Doctors can even personalize blood pressure reading thresholds for each patient and receive alerts for high readings that integrate through the doctor's EMR or the Omron Doctor dashboard. And printable reports are available through the Omron Doctor dashboard to show patients more information about their condition and to motivate them to make healthy behavior changes. Our team makes ease of use for physicians and care team a priority as well. We're actively listening to physicians' feedback and partnering with the most forward-thinking hospital systems and independent physicians in the U.S., including Mount Sinai in New York and Northwestern Medicine here in Chicago. Early feedback from physicians show that VitalSight is quickly helping doctors improve engagement with patients on their treatment plans. And now Northwestern is conducting a clinical study on VitalSight to see what outcomes we can achieve with the service. We are working with Dr. Stephen Purcell, the director of the Institute for Public Health and Medicine at Northwestern, and we've invited him to share his impressions on VitalSight.
Yeah, we're really excited to be evaluating this in a number of ways. So we've launched VitalSight in 2 pilot studies, 2 internal medicine practices, and we'll be doing it in 4 more in January. And what we expect to do is really do a matched controlled study where we're selecting other patients from other practices who are not being provided with VitalSight. And I think that the hypotheses we have is that several things will differ. We expect that the amount of medication intensifications will be greater with remote monitoring than without it. And we ultimately think that control of high blood pressure will be greater, both for patients who are able to get their medications adjusted through remote monitoring, will have better blood pressure control at home, but also better blood pressure control when they come into the office. So we'll be looking carefully at a variety of measures around blood pressure control, around medication dose adjustment and medication additions. And then we'll also be looking at the uptake. We'll be looking at whether or not we can support this with a care manager and how that might facilitate the appropriate use of home monitoring and greater attention to patients with uncontrolled hypertension.
Thanks for that perspective, Dr. Purcell. According to recent reports, 30% of prescription medications for chronic health conditions are never filled, and nearly half of filled prescriptions are not taken as prescribed. Treatment engagement and understanding the link between daily lifestyle habits and your blood pressure numbers is essential. VitalSight fosters greater patient-to-physician communication and data sharing, which engages patients more in their own hypertension management. Patient data is securely shared with their physician and care team to provide clinically relevant information that evolves treatment. As we roll out VitalSight, we'll be announcing more and more health system partners across the country. Now I'd like to introduce you to Cara Lucarelli, Director of Marketing and E-commerce here at Omron, to share more.
Thanks, Jeff. As we mentioned earlier, VitalSight has been the subject of research and development for several years, so our team could ensure that we were providing a service that upheld the same strict standards for quality and accuracy that we hold for all of our products. As Jeff noted, VitalSight is plug and play. So once patients receive their kit, there aren't any additional steps they need to take. They can immediately start monitoring, and their physician will be alerted to any high readings. We made VitalSight easy to use, so more patients would be willing to use it. Each VitalSight kit comes with a quick start guide that includes instructions on where to place the devices in your home and in-depth steps on how and when to take accurate measurements. We wanted to take the guesswork out of this technology so patients feel confident that they're measuring accurate readings and managing their condition at the same time. It's simple. The doctor prescribes VitalSight, the patient receives the kit, they start monitoring regularly, and the service begins. In fact, to assure setup is this easy, the Quick Start Guide is currently available in 7 languages, and I'm sure we've got more on the way. Our team knew that taking the extra steps to make VitalSight easy to use would help patients seamlessly build monitoring into their daily routine. That's why we also offer Omron customer service team members to follow up with patients once they've received their kit and to help with any other questions they might have in the future.
Welcome. You've been enrolled in VitalSight from Omron Healthcare, the remote monitoring program that gives you the power to track your blood pressure from the comfort of your home. VitalSight helps you and your doctor team up to proactively treat your high blood pressure and even potentially detect early warning signs of a heart attack or stroke so they can be prevented. In most cases, VitalSight is provided at little or no cost to you, depending on your insurance coverage. You'll receive a kit at home that may include a digital blood pressure monitor with cuff, a weight scale, a digital medication tracker, and a data hub, depending on what your doctor has prescribed for you. Getting started is easy. To set up the data hub, simply plug it in within 10 to 15 feet of the other devices in your kit. Everything is already connected. When it's time to use the monitor, make sure the hose is connected and it's placed so you can sit while wearing it. Your scale, if you received one, is ready for use right out of the box too. Always be sure to follow your doctor-recommended schedule. Take your blood pressure as soon as you wake up, midday during a rest period, and right before bed. To do so, sit quietly with your feet flat on the floor and don't eat, drink alcohol, smoke, exercise, or bathe 30 minutes beforehand. And avoid talking while taking it. If you received a scale, weigh yourself after taking your blood pressure and again just before going to bed. Always use the bathroom before stepping on the scale. Your readings are automatically sent via secure encryption to your doctor's office for review. If needed, you may receive a call from your physician to discuss adjusting your medications and treatment plan. Or you may get an urgent call if your readings suggest there are signs of a more serious health concern. Consistent daily participation in the VitalSight program is crucial to getting the greatest benefits. You get peace of mind as you and your doctor work together to help improve your health and prevent cardiac events. Make VitalSight part of your ongoing care and join us in going for zero. For more information on the program, visit omronhealthcare.com/VitalSight.
We believe that VitalSight will make a big difference. We believe it's going to help these patients live longer, healthier lives. And we believe it will save lives. You can follow Omron on Twitter, Facebook, and LinkedIn pages for future announcements on VitalSight and for any other news that we have coming out. And we invite you to connect with anyone on our team while we're here at CES. We're here to answer your questions, and we very much appreciate you joining us today.